from my perspective, it's very much when you look at the four key angles of transformation, which is how you deploy adequately your resources through proper workforce management. How do you manage and coordinate the deployment of your assets throughout the healthcare continuum? How do you basically coordinate patients throughout the healthcare continuum in a longitudinal way? So from patient engagement up to primary care, up to acute care, up to social care, and how do you properly plan and coordinate that level of activity? But then the last point is how do you coordinate data and the convergence of data sets in a meaningful way at the right time, at the right place. Yeah, when we talk about bending the curve, right, we're not just talking about bending the cost of healthcare or bending the cost of healthcare IT, right? What we are actually talking about is, with what is clearly stated under the new NHS long-term view, is that shift from, late disease into early health, that move towards prevention. And pretty much the emphasis of, keeping patients into the preclinical stages of their lives as long and as healthy as possible. I think there's a bit of a listen and learn type of element here, right? It's really establishing and creating that dialogue. I know there's already quite a lot of forums that are going on right now, and it's really putting the means to the end.
At HG, we observe that healthcare is a lagging adopter of technology. Healthcare institutions and companies spend perhaps 3% of their budgets on IT, and that compares to 5 or 6% in general business environments. And as a result, we see there being a wave of investment as that adoption of IT continues in healthcare. We at HG are investors in growth and are seeking to back the providers of software and technology into the healthcare sector. Our focus is pretty niche, actually. We focus purely on B2B, software, data, and technology-enabled services. So these are the systems that are used by our customers to deliver healthcare or to assess what type of care a patient needs, or to understand what information a patient needs to receive the care that they desire. In our view, continuing to invest in healthcare operations is going to be highly important if the aspirations of many healthcare economies are to be met. These systems will help those economies deliver healthcare at a lower cost, at a higher effectiveness and a higher quality across all of its patients in those countries. As a result, we see investing in healthcare operations businesses as a way to help those healthcare economies deliver their aspirations they have for their populations.